This morning to health news. Surgical treatment of obesity is a complicated and life-changing process. As with any surgical procedure, there are risks involved with weight loss surgery, and the surgery that you choose actually is a very personal decision based on your habits, risk aversion, and lifestyle. Dr. Thomas Martin is a general surgeon who specializes in bariatric surgery at Spectrum Health Medical Group. So we're here to talk a little bit more about what you should consider when you're looking at, surgical options for weight loss. Thank you so much for being here with us today.
Thank you for having me.
So what should they consider before they actually take this next step?
So you should consider talking with your doctor about weight loss surgery and learning about what options there are out there for you. Weight loss surgery is a very effective tool to help patients lose weight and keep it off.
Sure.
Unlike traditional diet and exercise programs, about 80 to 90% of our patients are able to maintain at least half of their excess body weight lost over the long term, compared to diet and exercise where it's only about a 5% chance of keeping it off long term.
And this isn't something that is for everybody. So what kind of risks as far as health, existing health issues should you take into consideration as a surgeon?
So in order for insurance to cover this operation, there are certain parameters that have to be met. One is your body mass index. You have to be considered obese, which is a body mass index greater than 45, or and have a 35, and have at least one obesity-related comorbidity, such as diabetes, high blood pressure, high cholesterol, or sleep apnea. If your body mass index is greater than 40, you don't need any other comorbidities to qualify for the operation.
So once you understand someone's history and you look at their health and you say, yep, you're a great candidate for this, I guess what is the process of going ahead to actually doing the surgery?
So seeing us at the Spectrum Health Bariatric Weight Loss Center, for a free seminar. We have multiple locations throughout West Michigan, including Grand Rapids, Zeeland, Muskegon, Greenville, and Reed City. And after meeting with us and discussing the different options, then it's up to your insurance process as to how long you have to wait for surgery. Certain insurances have a 6 or 12-month medical weight loss program whereby you learn about nutrition and how to adapt to the major life changes that are going to occur after the operation.
Absolutely. So this is one of the things too where you guys actually try to offer support groups for people too, whether they're just starting the process or they've been through it. Talk about the support that comes after someone has had the surgery to help them.
So we have a robust network of practitioners, both doctors, nurses, physician's assistants, as well as nutritionists and behaviorists that help our patients through the process. This doesn't replace a patient's family support network, which are also vital to their health afterwards. But we're all there to help people through some of the stresses that occur with a major life-changing operation and answer any questions that they may have as they go through the process.
And I think this is something that people need to realize. I've had Dr. Bittner on our show before, and she said that people don't need to be ashamed that it's kind of come to this point, right?
Absolutely not. This is a powerful tool to help patients lose weight. It's not a crutch. It's not something that is a cop-out or a shortcut. This is meaningful weight loss that you're able to maintain and really change your life. And most people out there don't know you've had the surgery. They just see this remarkable life change that you've undergone, and patients should be proud of the accomplishments that they've made.
Yeah, they get a new life in a sense.
Absolutely.
All right, well, thank you so much for stopping by.
Absolutely. Thank you very much for having me.
Sure thing. And to read some stories about those who've had the surgical weight loss, visit healthbeat.spectrumhealth.org. And also to learn more about what we just talked about, you can check out Dr. Thomas Martin with the Surgical Center. Thank you so much for stopping by.
Thank you.
Sure.